was a Class 4 felony. Now in Colorado, the felonies, the most serious is the Class 1 felony, first-degree murder. And they go down to Class 6 felonies, which are the least serious felonies. So possession of a controlled substance, no matter what amount, was a Class 4 felony. And we considered it a public safety issue. Now, how many in this room, that's changed, by the way, in Colorado, and it's changing throughout the country. How many in this room think that drugs should be decriminalized and we should treat addiction issues as a public health matter? Okay, you're not alone, right? How many people think that there is a place for criminal penalties for drug abuse? And it looks like maybe there are some people who don't know. Maybe you're uncertain. Who feels uncertain about it? Okay. Combination of both. Okay, there's a place for both, maybe. All right. So, in my career, possession of a controlled substance went from a Class 4 felony to a Class 6 felony. And that happened prior to my becoming, pretty shortly prior to my becoming the elected DA here when I was elected in 2004 and served from 2005 to 2009. So they reduced the penalties, and what the legislature said was, when they worked on the fiscal note, anybody know what a fiscal note is? Whenever the legislature passes legislation, they do a fiscal note. What is the financial consequence? They said, we're going to save millions on prison beds by declassifying this and reducing the penalties down to a Class 6 felony. And we're going to put that money into treatment. That's what they said, right? Well, they'd done that before, and so there were some savvy legislators at that time who said, okay, we've heard that before, so we're going to put a sunset on this law. And if you haven't actually put dollars into treatment by the time of this sunset of this law, it's going to be repealed. What happened right before it was to be repealed? Not within the years after they said that they would put money into treatment. What happened? They realized it was going to repeal, and they all of a sudden had a bunch of money they had to spend. Well, I was the elected DA at the time, and they created this committee where we were to spend dollars toward inpatient treatment programs in Alamosa, at Crusader, and at the STIR program. And so we got a few more people into inpatient beds than we would have otherwise. But were there any actual treatment resources developed in Fremont County, or Park County, or Chaffey County, or Custer County? No, right? No. Okay, fast forward, 2013. Now, 2013, the legislature borrows some law from California. It says we're now not going to have possession of a controlled substance be a Class 6 felony. It's going to be called a drug felony 4, and it's going to be a wobbler. And what that means is it's a felony named, but if someone completes treatment, it wobbles into a misdemeanor. And we're going to tell judges you can't send someone to the Department of Corrections to prison on that DF4 wobbler unless you make a record that you've exhausted every other alternative. Because in Colorado, at the legislative level, for over the past decade, the movement has been toward decriminalization of addiction, decriminalization of drugs, with the promise of dollars toward treatment. But that has not come. And that doesn't mean that there aren't people doing great work here in our communities in treatment. There are. And these grants that you're talking about, especially the mental health sort of a team approach, I really look forward to that. That's wonderful. But in terms of meaningful on-the-ground resources to assist with our jail population, for example, nothing has meaningfully changed in our rural communities as that decriminalization has occurred. And so we have fewer resources now to contain drug offenders, to keep them out of the community. And we have fewer resources for them when they are in the community. That is just some historical perspective.
Well, hello everybody. I am Dwayne McFall, Chairman of the Fremont County Board of County Commissioners, and I, like the other folks up here, would like to thank everyone for being here. It shows that our community is concerned about the problems that we're having, not only in Fremont County, but nationwide, actually. I was approached probably a year and a half ago. An attorney for a law firm came into the office and started talking to me about the opioid problem and lawsuits that were starting to happen against manufacturers of these opioids. It was mentioned a little bit down here, but I want to go into a little more detail about that. The prescription drug problem is huge, not just here, but nationwide again. We as a county after about a year and a half of research through our attorney, decided to get involved with a lawsuit that's happening against these manufacturers of these opioids, these prescription drugs, the painkillers and stuff. When they initially broke out their advertising and their marketing of these opioids, they were marketing them to doctors and not letting them know the truth about these opioids, how they were addictive and how harsh they were, different things, and they were really pushing them, so the doctors were just prescribing them, over-prescribing them basically, and then people were getting hooked on them. So this lawsuit that we are now part of, as of January, we started out with a state lawsuit. Well, it eventually morphed into a federal lawsuit. There's others happening around the country. There's one in Oregon or Seattle somewhere. This one is a Colorado federal lawsuit. There's 17 other entities in Colorado involved with this. There's some cities and counties from all over the state involved in this lawsuit. So what the idea of this lawsuit is to get these drug companies to pay for what they have caused. And this is an example of what it's caused, is people having to do what we're doing here today. So on top of that, I would like to, as Timmy mentioned at the top, we have Lisa over here who has some resources that our public health department is very active in this front. They've done a lot of good work around the community, locally, right here in Canyon City, but around the whole county. Several things that they're doing. I'm just going to read some stuff that I was provided by Emma Davis. She is our public health director, and it's pretty interesting. Some of these are some stats here that she provided for me. Opioid use is a significant public health crisis nationally and in Colorado. There are 224,000 Coloradoans misusing prescription drugs each year. And that increases, and that goes back to those prescription opioids that people are having trouble with. And then it was said earlier that when their prescription runs out, they do something different to get their fix. So it's an epidemic. And between 2013 and 17, there were 12 opioid-related deaths in Fremont County. I think that there's in the latest years, it's on the rise, and that's unfortunate. Our public health department was awarded a 2-year, $100,000 grant to work with providers in our community to educate on safe prescribing guidelines and awareness to the community and focus on prevention of opioid-related overdoses. So Fremont County has formed a regional coalition to address the opioid and other substances crisis. The coalition is made up of medical providers, judicial, law enforcement, commissioners, public health, human service, mental health, and community members from Fremont, Lake, Custer, and Chaffee counties. Now this coalition has 3 action teams, and they're focusing on prevention. Prevention is providing education for the prescribers, not only for safe prescribing guidelines, but also how to identify and work with patients when they have a substance abuse disorder. And then also promoting safe disposal of medications and disposal sites in Fremont County. There are some disposal sites where you can get rid of the pills that you no longer need. There's a disposal site at the Canyon City Police Department and one in the pharmacy at St. Thomas More Hospital. As well as you can take them to just the police department or the health department, anywhere where these people can get rid of these prescription drugs. The second action item here is a harm reduction. So it's training businesses what to do when they find needles on their property, like Ashley mentioned a little bit ago, finding them at the parks, how to safely dispose of the needles. We're partnering with law enforcement, Canyon City PD, other partners to provide the sharps containers so that those needles can be deposited in there and then just gotten rid of safely. So with that also comes training of the community members how to use Narcan and identify signs of overdose. Some people, and I've heard it myself, they think, well, they overdose, just let them go, it's just a drug user. Well, that's not all true. They're not just hurting themselves, they're hurting their families and they're hurting their community. So it's not just that person, and that's where Narcan gives that person another chance, gives that family a chance to help that person. The third action item is treatment and recovery. We're working right now with Sovista and some other partners, trying to build a detox center and potentially a residential treatment center. So there's a lot of things that are happening in the county that a lot of people don't know about, and it takes groups like this to get the word out, and everybody's hand and volunteer and just getting the word out and being aware of what's going on. We are also, the Public Health Department is going to have a deal similar to this, April 11th at the Canyon City High School, and it's to discuss opioid crisis. Again, there'll be medical professionals and probably somebody that's been affected like we have here today. So there'll be more information out on that as it gets closer, and that is April 11th, but I thank everybody for being here. Thanks, Timmy and the Republican women, for setting this thing up for us. Thank you.
Well, thank you. Well, we need questions, and this is an opportunity for everyone in this room to get your questions addressed. And if you have questions for our treatment providers or resource people over there, please submit them, and then we'll get them asked, okay, so that they can address it also. You know, a lot of times I flow through the community on different levels, and this problem is out there. And I guess what I'm trying to do with bringing this all together, I'm tired, quite frankly, of hearing people complain. I'm quite frankly tired of having people talk about how one part doesn't help, or playing all of the people at this table off against one another. It's got to stop. We have to step up and stand up. And they are here together as a team. They can get things done through you coming to them, being involved with them, getting to know them today. It can get done, but it can't get done instead of just going around the town, I'm sorry if you're going to be mad at me after saying, but whining. You know, they're very friendly people. They will answer the telephone. They didn't know who I was, called up, and look what I got. So please ask those questions today. There may not come another time that this group of people are going to be together. Brad has absolute first-hand knowledge. And he's somebody today that if you ask the questions to, you're going to get some answers back. If you have somebody in your family that is using, is on the verge of using, Brad is someone that can respond to you in a very different way than anybody at this table. He paid a high price for making a choice to use. And you know, there are a lot of great questions if you'll just ask them, so please, and then please eat, keep eating. And again, thank you to the VFW. I also want to thank the media for being here today. We have the Fremont County Crusader, the Canyon City Daily Record. Carrie, thank you for that article. I sincerely appreciate it. Carol Ann was also a great help, in case you listened to that in the morning. So please, we're waiting on some questions to get in. We do have a few. And Kelly, you want to bring them over, okay? And you do it.
Oh, I get to do it.
Oh yeah, I'm done.
You said you were doing this part.
Okay, so the first question I have is what resources are available for individuals who have addiction problems that may suffer from chronic pain and self-medicate with some heroin because the doctors no longer prescribe for them? Anybody up here that might have an answer to that? To anyone who has an answer?
I think the best people to answer that would be mental health
Somebody over there?
or public health.
My name is Tammy Lizzie. I'm a registered nurse. I work at Sovista Health. Opioids have certainly been at the root of this problem, and we do work with treatment providers to address people's chronic pain issues. There are some treatment providers in town, and we have a multidisciplinary approach. We try to incorporate many different things into treatment for pain. Pain is a big problem, and getting people treated adequately for pain is really important. There are alternative ways to address pain issues, and that's one of the things that we're focusing on in the community. There's a clinic here called Metamorphosis, and they are a pain clinic, and they do a really remarkable job of helping people deal with their pain. Our treatment, local medical providers are also becoming more and more involved in dealing with people's chronic pain. We at Sol Vista, and I think you guys also have some really innovative programs to deal with people's pain, some mindfulness-based programs, some, they call it AcuDetox. I don't know if you guys have ever heard of it, but it's auricular acupuncture. They put needles in your ear, and that helps with some stress reduction. There's lots of alternatives out there. I think one of the biggest problems in our country is that people have become very used to taking a pill to solve a problem. And our mindset is having to help people understand that these things are changing and that pills are not always the solution to problems, that there are lots of other things that we can consider besides opioids to treat pain. I don't know, Karen, would you like to talk about the issue also? I'm trapped.
There goes the mic. So at Gateway, we also offer a variety of services. We have the behavioral health, which includes the mental health and the substance abuse. We offer medication-assisted treatment, specific Vivitrol and Suboxone. And so that is the medical modality to assist with the opiate, as well as the substance abuse treatment. So we offer the mindfulness, we offer different coping mechanisms to help with the recovery process. A lot of times with Vivitrol, they have the fear of the withdrawals, and so that keeps them stuck in that cycle of using. With the Vivitrol, there is a period of time that they have this remain abstinent to be able to clear their system of the opiate to be able to have the Vivitrol. So that can be very challenging. So we offer some different modalities with that. There's some medications that can help with assisting with the withdrawals that can be helpful to get them through that period. We have several clinicians that are very well versed in this area and are very caring and empathetic to the needs and really find a way to help individuals. So getting them through our doors is the biggest step. It takes courage, lots of courage to come through the door and say, I need help. Anybody else want to address this?
Hi, so at Southern Peaks, our primary population is between 10 and 20 years of age. And so we don't do as much, with the medication for the substance use disorder, but we do treat medication for like the mental health underlying issues. And then from there, we offer groups and programming. We offer the AcuDetox, like what you were talking about, just looking at some alternative ways. And it is a residential treatment, so naturally, they have time to, let their brain heal and learn some skills like mindfulness and what these ladies have talked about to be successful. And so that's one of the biggest things that we try to promote. We're trapped, so.
Not everybody else.
Okay, so this next question is for Brad. It said, what is the most effective family response for a family member on meth?
I would probably say don't give up on them. Whenever you're in the throes of addiction and you're dealing with something that's bigger than yourself, it's a lonely place to be, because a lot of times you haven't told anybody, exactly what you're dealing with, and you're the only person that really knows. And just to have somebody there that will listen and you know, not judge you, and just being empathetic to an extent. I mean, there is that point that, I mean, if they're robbing and stealing from you, your life's in danger, that you need to get some outside help. I mean, you can't love them through that. You know, you can still love them, but, I mean, if your life is in danger, there's jeopardy of your possessions coming up missing, you should probably go find another avenue. You know, usually by the time the addiction has got to that extent, they're needing help, whether they know it or not at that point, big time. And usually law enforcement's not too far behind them. And you know, being able to spearhead it to where you can get that person into treatment. And let me take a step back. For a person that goes into treatment, I mean, it has to be their choice. You know, if somebody makes them go to treatment, I saw a statistic one day that's like less than 50% actually make it. But for a person who says, you know what, I got an issue, I have a problem, and I need help with this, and then the recidivism, I can't even talk right now. Recidivism rate of actually, you know, going back into the drugs and things like that, you know, is drastically lower. And so I would encourage you, if you do have a person in your life that is dealing with heroin addiction, meth addiction, just alcohol even, you know, any of those things, to try to, in a nice way, I guess you could say, try to get them to think about going into programs, you know, visiting an AA meeting with them, an NA meeting. Celebrate Recovery is a great program too. You know, any of those places where they would feel comfortable, that they can talk to, they can meet other people that are going through the same types of things that they are, but also trying to get help. So hopefully that helps a little bit.
Okay, so I'm going to do the second part of this one. What do you see, and this is for Bob Hill, what do you see as the best indicator that a student is involved with opioid or heroin?
Student?
Okay, so I think the best indicator is going to be that their personality completely changes. They're no longer that fun-loving kid that either likes sports or likes to be involved in the clubs, isn't hanging out with their friends anymore. They stop that, or they lack interest in it anymore. Their personalities will probably completely change, and I don't mean like a teenager would, because they're teenagers, they go crazy. But I mean completely different. They're not acting normal, they don't want to be out of the house, or they're always gone. They leave you. Like Brad said, their friends change from a total different type of friend, not a supportive friend anymore. It's the ones that are destructive, the ones, when you see them walking down the street, you know who they are. So I think that's probably their best indicator, is watch their attitude, watch their behaviors. If that's changing, you need to have a serious talk with them.
To counteract that, yeah, it's the exact same thing. If there's behavior changes that happen in school, their attendance starts to go down, their discipline referrals start to go up, they start to lose interest in many other things, they may revert to criminal kinds of activities, other kinds of things start to kind of pop up. So those are the biggest indicators as far as that goes.
I would encourage parents, go into your kid's room and check their rooms. You know, there's no law that says that you can't go and look through their drawers or their shoes or their coat pockets or whatever else. If you think there's something up with your baby, go out and find out what's up. And that's probably the most proactive response you can do as a parent. I mean, you have a lot to say as a parent. By the time they get to be 18 plus, then you get a lot less to say. So I would encourage everyone, if you think your kid or somebody's involved with something, start having those hard conversations and start checking their rooms.
Okay, the next one is just an information about Nar-Anon. I cry, I'm emotional. There is a Nar-Anon meeting every Tuesday night at the E-Free Annex out on East Main at 6:30. So it is a great resource for Fremont County. There's information up here too on Nar-Anon. And Al-Anon is up here also. Nar-Anon is for the family, and so is Al-Anon. Yes, Nar-Anon is more narcotics, and Al-Anon is more alcohol. But it's all behavior. So It just helps the family. Okay, the next one is how do we obtain Narcan?
Excuse me?
How do we obtain Narcan?
Rocky Mountain Behavioral gives me that.
Hi, Lisa Snow. You can actually contact Christina Taylor with the Department of Public Health. What you would do is sit down and watch a 7-minute video on how to distribute it, and then you walk away with Narcan, and you can save a life. So, how much is it? Free. Yeah.
There's also some legislation that was passed in Colorado which makes Narcan available to people by walking into the pharmacy and asking for it. There's a copay and people have to pay for that. Physicians can also write prescriptions for it. There are different organizations in town. So this is working on coming up with a program where we will be providing it. Do you guys provide it also?
We do actually have it right here, but we also give it out to the public. They just come in, they sit down with us, we're trained, typically clinicians are trained in it, and we just have to train the person and then they
It's very easy to use. It can save a life. We've had, there's different kinds, but the easiest one to use is the nasal. He's got it right here. You basically stick it up somebody's nose and give it a squirt. And it actually saves lives. I know there was a comment made that you had said, you had heard, or have heard comments that are made. But every one of the people who is a person who uses substances has a family. They're all somebody's family, and somebody cares about them. And so while I think sometimes it's easy to look at them as those people or other people, most of you will have someone in your life who is affected by this, and everybody is loved by somebody. They're somebody's brother, sister, child, parent, grandparent. Oddly enough, I think we have some ideas about who these people are, and we see people who are professionals, who have professional jobs. We see rich and poor, male and female, young and old. So it can affect anybody. And the first step is saving their life, and then they can get to treatment. You can't treat a dead person, but you can treat a live person. And sometimes people have to go through this several times, and it can be very frustrating. But each opportunity that they're still alive gives us another opportunity to help them.
I just wanted to tag on to that prescription at the pharmacy. I was at a convention and a person from Colorado Department of Public Health said that you go to the pharmacy, you tell them you want a Narcan for a family member, and it should be free, but you shouldn't have a copay, so try it.
Okay, we're going to hand off to the fire chief here. It'll work, right, maybe. Is it on? No? There we go. That's better. Okay, we're going to hand up here, and you might want to answer that question.
Okay, Narcan, I believe Commander Hill mentioned it earlier. The law enforcement in the county here carries Narcan, as well as our fire department apparatus and the AMR, the private company that does ambulance transports. Narcan is effective against, I don't remember all the details, my EMS skills are a little rusty at this point in my career, but it is effective against opioid overdoses. It is not effective against all drugs, and one of the things about Narcan is that it has very little contraindications that it's harmful if you do administer that to somebody. And that's kind of why it's prevalent out there now in society. One of the things, and Timmy had made a comment to me earlier in the day about someone had said to her that, don't call 911 when someone's having an overdose or a suspected overdose, and that is not the case. Even if you do administer Narcan individually, you need to call 911 and get appropriate medical response to come to the scene. Because the Narcan you administer might or might not be taking effect on that person. It might not be an overdose that's being counteracted with the Narcan. And there could be other underlying medical conditions. So always dial 911, even if you think there's a medical emergency, if you think there's a possible overdose. And typically you'll get law enforcement and fire EMS to respond. And since they are carrying Narcan as well, they have that ability if law enforcement's on scene before us.
Chief, can I tag something on?
Yes.
Thanks. To tag onto that, some people are not aware that if you, let's say you were using with the person who's overdosing, right? And you yourself might be concerned about calling 911 because you have been using and you might fear arrest, for example. If a person calls for another who is suffering an overdose and remains on scene with that person, they're immune from prosecution, even if they were using with them. So.
And, you know, the fire EMS side of things, we don't enforce law, we don't arrest anybody. And typically, depending on how that 911 call comes in, usually it's the fire EMS side that is dispatched to that incident initially. Now, whether law enforcement comes or not, but as the DA has said, there's been some changes in the laws in regards to that in order to protect those individuals, give them some immunity in making that call. The strongest suggestion I can make today is make the call and make sure when first responders arrive on scene that you identify that you have given them Narcan. Or if you know what the person has taken is a key piece of information as well. Many times individuals that might be partaking in those drugs at the time, someone has an adverse reaction and the other parties that are there are afraid to say exactly what they were doing. But it's imperative that we know what that base substance is so we can address it appropriately.
Chief, isn't Narcan just a blocker? It's a temporary blocker, so if they don't seek treatment, the drug can come.
And I apologize for not being up on all the background on the Narcan itself. The EMT people that we have, the paramedics, they know all of that information on that, and I just can't fill in the blanks accurately right now on that. Someone else might be able to.
Yeah, so the Narcan is an opioid antagonist blocker, so it will knock the opiate off of the receptors in the brain, which will plunge the individual into immediate withdrawal symptoms, which are pretty uncomfortable and pretty serious. And it does wear off after some time, and depending on how much is in their system, they could put themselves at risk later. So it's very, very important that you call 911. And as the DA rightly said, we do have a Good Samaritan law in Colorado, and you cannot be prosecuted if you remain with the individuals.
Okay, the next one says, what will Canyon City, Fremont County's position be regarding having the injectable sites? And perhaps explain what the injectable sites and what it will mean for Fremont County.
So, personally speaking, as a county commissioner, I don't think that's a great idea, having injection sites. That's my opinion. If that ever does come down here like we're hearing it talked about in Denver, I think we'll deal with it, but I don't foresee that happening.
So for those of you who don't know what an injection site is, it's a safe place where they can go and use a clean needle to inject pure drugs, not street drugs that are cut with ether and other things like that. And they'll use clean needles. then they can sit there and be monitored so they're not overdosed. I don't think we as a community want that here. We don't want a safe place for people to go shoot up. Because when it's closed or there isn't anything available, we've created these people who are now hooked. I think we should be treating them, not enabling them.
I would just offer the alternative perspective, not in disagreement, and I think that's something that our panel have a part in deciding whether we would have that in our community or not. But the argument for it would be that they're no longer using it in the park, and your children are less likely to get pricked by a needle. The majority of use does happen in public places, particularly in public restrooms, and so even when you go to McDonald's or Starbucks, there's a risk that, or our workers at McDonald's when they take the trash out, that they get accidentally poked. And so that's kind of the other side of it, the other argument for it, but I understand that in Fremont County, we have to make the decision what's best for our community. And that's an interesting conversation to be having.
Okay, the next one says, does methadone help or continue the addiction?
So medication-assisted treatments are a very valued therapy. Methadone is one of those. There are several others. It's a very controversial subject, and there are some people who believe that all you're doing is continuing the addiction. There's also a lot of evidence to the contrary, that you're managing someone's addiction. A lot of times we talk about it in terms of like we would talk about diabetes. So, if you're diabetic and you take insulin, are you dependent on insulin? Are you addicted to it? Well, you're pretty dependent on it. If you don't have it, something bad is going to happen. The same theory and philosophy is also talked about with medication-assisted treatment. Again, it's controversial. It's very much in the realm of harm reduction. I don't know how many of you are familiar with that term, but there is a theory about harm reduction, that you supply people with needles or medication, which reduces their illegal use and reduces the harm because you know how much the person's getting. It's always done in a very controlled setting. There's different types, so methadone is one type, and methadone is an opiate that is used to replace another opiate. There are also treatments that are not, they're medication-assisted treatments that are not opiate-related, and they actually block the receptors, which people can drink alcohol, for example, and not feel the high. It's a complicated subject, and if we had more time, we could go into it more. We're happy to talk about it. We're also happy to participate in further community discussions to talk about medication-assisted treatment. Karen has talked about the fact that they provide that. Solvist is also going to be providing medication-assisted treatment. And there's also some other members of our community, professional members who, medical physicians who also provide that treatment. So we're happy to discuss it. Come on up after and we can give you more information about it. Did you guys want to say anything about that? Okay.
I'll ask a question real quick. What do you think would be, do you think the cost for Fremont County would be more if they use methadone or Suboxone or something like that to medicate the withdrawal, or to do a medical withdrawal? Which one would be more expensive to do? To give the methadone, the Suboxone, or to take them through a complete detox to get the drugs out of their system?
So there are different types of detox. There's basically a social detox where people go and there's no medication assistance. There's really there's monitoring, but not really medical people that are there to make sure that things go well. Basically, it's trained personnel who observe, and if something bad starts to happen, they can call and get that person transported to the hospital. Socially detoxing is a really tough road. And the reason why a lot of people who use opiates don't detox is because it's extraordinarily painful. People get really ill, and it's really, really tough. If you've ever seen somebody detox that way, you can understand why they don't want to do it. There's another way to detox, which is done medically in a controlled medical situation, usually a hospital type situation, where other medications can be given to help so that the withdrawal is not so painful. That's very costly. Methadone, again, it's a controversial subject, and we don't have a methadone clinic here in town. There are some methadone clinic, or a methadone clinic in Pueblo. It's considered a cheaper alternative because it's not actually detoxing, it's replacing. But these are, again, we're talking about having a detox. We're talking about partnering with with Fremont County to come up with a way to offer that service to patients. It's just, it's a tough way. And so it depends on what you're detoxing from and how long you have been using, as to the degree that you're going to withdraw. And alcohol, detoxing from alcohol can also be very scary, can also be a medical situation that needs to be monitored, or it can be done socially. So again, these are complex subjects that are hard to really have an adequate discussion about in a short period of time. I think we have a great group of community members who are tackling these really, really, really difficult subjects and trying to come up with a very, very responsible, reasonable way to handle this in our county, but it's a challenge for sure.
I just want to say thank you, Tammy, for introducing that idea, and we're both hitting the controversial topics today. But I think one of the things with medication-assisted treatment is there's costs, and that was a question that was brought up, the cost. And there's costs associated with treatment, and there's costs associated with absence of treatment. And depending on the level of your condition, your situation, different treatments may be recommended. And I think if it's done, it can be done in a very, very good way, and there's probably some examples in your head of it being done in a very poor way. And I would say nobody here wants to do it in a poor way. And then the other thing I was going to add is the cost to our community, again, in terms of ER visits, in terms of police contact, in terms of detention at the detention center. Those are high costs in our community. And if an individual can function very well for a period of time without having to visit the ER, without being a taxpayer, being able to get a job, and they're on this medication every day that's controlled pretty carefully by their provider, then perhaps that's something that could be helpful. But it's not for everyone by any means, and it definitely needs to be assessed. And it's kind of the same way that if someone's suffering from cancer, chemotherapy is not the answer for everyone who has cancer. It really has to be assessed, and the right treatment has to be prescribed. And I would say that medication-assisted treatment is one option in kind of tackling this issue. And there are side effects. There are issues that go along with every kind of treatment, actually. And so those have to be weighed as well.
And I think you make a valid point. One of the things that we see with medication-assisted treatment is that people are able to maintain their lives and their jobs, their families, their relationships. These treatments can very much help people live their fullest lives. And so it's really awesome when we see people who can continue to be employed to work on their issue while they're still getting treatment and not having to be in more expensive alternatives. inpatient hospital treatment is very expensive.
Okay, so the next question is for anyone. What is being done to educate local physicians on overprescribing addictive medications?
So there's actually a Region 13, 4 counties that were talked about earlier. We have a coalition for opioid use disorder and all other drugs, but this coalition is focused on, and particularly the prevention and harm reduction part of this, is trying to get providers to come to things about medication-assisted treatment and other signs of opioid use disorder. There's just keep your eyes out for more events like this, because you will find that people will train you in Narcan. They will talk to the providers. They will do anything they can to help the community move forward with this.
Okay, this next one is for Dwayne and Ashley.